Have you ever heard of a disease that turns your skin bright red like a sunburn and makes your tongue look like a strawberry? Sounds like something out of a horror movie, right? But it's real. It's called Scarlet Fever. Today, we're diving deep into what it is, why it happens, and how to beat it. If you're a parent, teacher, or just curious about health mysteries, stick around because this information could be incredibly important. Hit that like button if you're ready to learn. First off, what exactly is scarlet fever? Also known as scarlatina, it's a bacterial infection that often tags along with strep throat. Picture this: a bright red rash covers most of your body, feeling rough like sandpaper. It usually starts on your face or neck and spreads to your arms, legs, and torso. If you press on the rash, the skin turns pale for a moment. Along with the rash, you'll likely have a super sore throat, a high fever, and chills that make you shiver. But wait, there's more to the symptoms. You might notice red lines and skin folds, like under your arms, in your groin, and at your elbows, knees, and neck, that get even darker than the rest of the rash. Your face might get flushed red, but with a pale ring right around your mouth. And the tongue? It can turn bumpy and bright red, sometimes with a white coating at first, earning it the nickname strawberry tongue. Other common signs include a fever over 101 degrees Fahrenheit, swollen and tender lymph nodes in your neck, headaches, nausea, vomiting, and trouble swallowing. The rash typically lasts about a week, and then your skin might start to peel, similar to how it does after a bad sunburn. So what causes all this? It's all thanks to the same bacteria that causes strep throat, group A Streptococcus. These bacteria release a toxin that leads to the rash and the red tongue. It's contagious and spreads through tiny droplets when an infected person coughs or sneezes. The incubation period is surprisingly short, usually just 2 to 4 days after exposure. Who's most at risk? Kids between 5 and 15 years old are the prime targets, especially when they're in close quarters like at school or home. Sharing snacks, drinks, or utensils is a big no-no, as that's a fast track for the bacteria to spread. Now, you might be thinking, is it really that serious? Well, if it's ignored, it can be. The bacteria can spread to other parts of the body, like the tonsils, lungs, skin, kidneys, blood, or middle ear. In the worst-case scenario, it can lead to something called rheumatic fever, a serious condition that can damage the heart, joints, nervous system, and skin. Imagine a simple sore throat turning into long-term heart problems. That's why catching it early is key. Back in the day, scarlet fever was a much more dangerous disease, but thankfully, antibiotics completely changed the game. So how do doctors diagnose it? A doctor will typically check the throat, tonsils, and tongue, feel for swollen nodes, and examine the rash. To confirm it, they'll do a quick throat swab to test for the strep bacteria. If the test is negative, it means something else is causing the symptoms. When it comes to treatment, antibiotics are the standard solution, usually penicillin or a similar drug. It is absolutely crucial to finish the entire course of antibiotics, even if you start feeling better. This ensures the infection is completely gone and lowers the risk of complications. Kids can usually go back to school after being on medicine for 24 hours and once their fever is gone. To help manage the symptoms at home, you can use ibuprofen or acetaminophen for the fever and sore throat. Staying hydrated with plenty of fluids is also really important. For older kids and adults, gargling with salt water can soothe the sore throat. Using a cool mist humidifier adds moisture to the air, which can also help. Lozenges for kids over 4 and soft foods like soup or ice pops can make swallowing easier. It's also a good idea to avoid irritants like smoke. Since there's no vaccine for scarlet fever yet, prevention comes down to good old-fashioned hygiene. Wash hands frequently with warm, soapy water. Don't share utensils, glasses, or food with others. Always cover your mouth and nose when you cough or sneeze. If someone in your house has it, it's a good idea to wash their dishes and toys in hot, soapy water to disinfect them. And here's a quick mythbuster. Myth: scarlet fever is a disease of the past that's gone forever. Fact: it's still around, but now we have effective treatments for it. So there you have it, scarlet fever demystified. It can sound scary, but with modern medicine, it's very manageable. The key is to stay safe, stay informed, and always see a doctor if you or your child show symptoms. Thanks for watching. Subscribe for more health hacks and comment below. What's your scariest childhood illness story? See you next time.